Good morning, good morning. My name is Autumn, and I am going to be your nurse this morning. How you feeling? Okay. Well, today we have scheduled an abdominal examination. Could you go ahead and tell me your first and last name? Okay. And your date of birth? Okay. Brittany Spears? And where exactly are you right now? South College Memorial Hospital? Okay, great. So I'm gonna go ahead and scan your ID, scan. So we're gonna go ahead and begin with our inspection first. So I'm gonna go ahead and lower this railing. And we're going to put you flat for better inspection. Let's say you only need. Alright. Almost. Okay, perfect. So, I've washed my hands. I'm just gonna inspect, so I'm gonna go up ever so slightly. Okay. And we're just going to expose your abdominal area. You're going to completely ignore this today, but we typically would expect for the shape. So she is on the smaller side, so we're going to pretend like she's got a cave, like a concave, like it dips inside. So that is called a phalloid shape. She's not round. We're also looking for any signs of ascites or distension, normally seen in obese patients, and we are going to see her midline. Her umbilicus is right on that midline, so that's good. We want to look for symmetry, and most importantly, we want to make sure there's no discoloration. So her skin color is appropriate for ethnicity. So we've got her exposed. We've got her abdominal exposed. We've inspected her. Her shape is good. There are no lesions, no lumps, anything we should be particularly concerned about. Now we're going to go ahead and auscultate. That is our step 2. So when we auscultate, but it wasn't until she was probably getting out of high school. Perfect. So I am going to start in the lower right quadrant. So there are 4 quadrants. The lower right is on this side. So we'll start here. We'll listen for 10 seconds on each quadrant. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3. So they have drop factors on 6, 7, 8, 9, 10. And there's 10, 15, and 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I started on the lower right. I went from lower right to upper right, to upper left to lower left. That is how our GI tract. I just went along the GI tract. I heard about 2 bowel signs every 10 seconds. So we times that number by 6, so that's 12. She is normoactive. Of course, if it was higher than 30 in 1 minute, she would be hyperactive, and if it was lower than 5, she would be hypoactive. So after we have auscultated, I'm just gonna adjust my mask and wash my hands again. Washing my hands, practicing hand hygiene is important. Now I'm going to palpate. I'm going to start in that lower right quadrant again with one hand. I'm going to go about a half inch deep, and I'm going to look at her. I'm going to observe her facial expressions, and also look for any tenderness and ask her if she's feeling any pain. So I'll go about a half inch deep. How are you feeling, Brittany? Does that hurt? Does it feel tender or anything? She'll say no. So we'll move on to the upper right quadrant. How about that? Does that feel tender at all, or is it deep? Okay. She says no again. I'm going to go ahead and do it for the rest of the quadrants. So we're on the upper left, no tenderness, no pain. And I'm still observing her facial expressions. Okay? What about here? Tenderness or pain? Okay. So second, we're going to do our deep palpations, and that's when we go about between 2 to 4 inches deep. So I'll start. Go down. No tenderness, no pain. You doing okay, Brittany? Okay. And it's important to look at the facial expressions because, some patients might not feel comfortable telling you. So we just want to, we want to double check what she's saying with her facial expression because facial expressions can sort of contradict what the patient is saying. Okay. And the last quadrant, no tenderness, no pain. Okay. Brittany, that is the end of that examination. I'm going to go ahead and put you back in a normal position. Go ahead did you have any questions for me today, Brittany? Yep, that's all we had scheduled for today. You seem to be doing pretty good. I'm going to go ahead and put the rolling back. Can I get you anything? Okay, well the doctor will be in shortly. If you need anything, your call light is on the bed near you, and have a good day. And I'm leaving the room, washing my hands again, and we exit.